My name is Shawn Ashcraft, and I'm the Vice President of IT. Welcome to Thoughts with Leaders. I believe AI is going to be the most transformative technology of our lifetime, and I can see it positively influencing nearly every aspect of the healthcare system. Now, at Midmark, we're utilizing AI to design better, smarter diagnostic solutions and integrating data into the customer's workflow. And ultimately what we're after is we want the clinician to have the best possible data when treating the patient, because the best possible data leads to the best possible decisions, and that improves patient outcomes. Cybersecurity is a top priority at Midmark, and we've done a lot over the past several years to become a best-in-class organization. We've been consulting with the FBI to help shape our cybersecurity strategy. We recently implemented disaster recovery capabilities, and more recently, we have implemented a cyber response team that can respond to any cybersecurity threat once detected. And this commitment goes all the way to our executive leadership team, where we get together on a regular basis to exercise simulations. So in the event that we ever get a cybersecurity incident, we know exactly how to respond. At Midmark, we are building an organization that is embracing AI. We've invested a lot in training, in various tools. Most importantly, we've cultivated an environment for experimentation. We've also established an AI governance team who is driving AI across the organization. And their vision is that AI is intended to enhance human performance, not replace it. Because we believe that if you take a capable Midmark teammate and give them the power of AI, they're going to solve the toughest problems in healthcare. At the core of who we are at Midmark, we design clinical care experiences that have the power to transform care. And when we do that well, we see a lot of great outcomes from a human perspective. One, we see clinicians really focusing and listening to their patients rather than doing paperwork and typing in their EMR system. We also see patients who are more encouraged to seek out care because they feel listened to by the clinician and they're not spending hours waiting around in the waiting room. And finally, we see great doctors extending the time that they're practicing medicine because they're not overwhelmed by burnout. When we integrate our solutions seamlessly into the workflow, that provides a better experience for the clinician, a better experience for the patient, and that ultimately leads to better patient outcomes. So I've had the opportunity to focus on healthcare technology my entire career because I've always wanted my occupation to have meaning and to have purpose. And what excites me about leading technology at Midmark is we get to focus on the front end of healthcare. When a patient is already hospitalized, there's already something really wrong, they're already very sick. But when we bring new innovations to primary healthcare, that's where we get the opportunity for advanced disease detection or preventative care. And that's what can make the biggest impact on the healthcare system. Thank you for joining me with this segment of Thoughts with Leaders. Until next time.